Hi there. Welcome to the overview of your medical scheme benefits for 2025, brought to you by NMG Benefits. This video highlights and summarizes the various options available on Discovery Health. NMG is an authorized financial services provider. NMG staff are fully accredited with the FSCA, the Council for Medical Schemes, and your medical aid. As one of the largest financial services intermediaries in South Africa with more than 30 years of experience, we can assist with various elements of your medical scheme and provide you with independent advice on the most appropriate option. In this presentation, we are going to take you through the three main components of your medical aid, provide you with an option summary, take you through the wellness program benefits, and lastly, look at the monthly contributions for 2025. Let's move on to the overview of the three components of your medical scheme: hospital cover, chronic cover, and day-to-day cover. Hospital cover is the most important element of your medical scheme. Hospitalization is unlimited on all Discovery plans. The executive plan reimburses hospital claims to 300% of the Discovery Health rate. Classic plans reimburse hospital claims to 200% of the Discovery Health rate. Essential plans, as well as the coastal and key care plans, reimburse hospital claims to 100% of the Discovery Health rate. Plan procedures need to be pre-authorized with your medical scheme by contacting Discovery Health on 0860 998877. Members on a Delta, Coastal, Smart, or Key Care plan need to make use of the network hospital in the case of planned procedures. Please be aware of the day surgery network, where certain procedures must be performed in one of the designated day surgery clinics in order to avoid a co-payment. In the case of an emergency event, members must go straight to the closest hospital. It is recommended that members always carry their membership cards with them. It is becoming more important each year to consider taking out gap cover. Gap cover is a short-term insurance product which can be purchased separately from your medical scheme and is an effective way to ensure that you are covered for hospital shortfalls. These shortfalls arise because there is no forced regulation on provider charges. Medical schemes may only cover up to a certain rand value or your medical scheme has co-payments and deductibles. Gap cover will assist in covering the resultant in-hospital shortfalls. Please contact your NMG consultant to discuss the gap cover options available to you. Let's move on to your chronic cover. Discovery offers cover for medication relating to 27 chronic conditions which are paid from risk. Members on the comprehensive and executive plans, with the exception of the classic Smart comprehensive option, have access to medication relating to 49 chronic conditions. Should your doctor diagnose you with one of these chronic conditions, it is necessary for your doctor to complete a chronic application form and submit this to the scheme. This will ensure that your treatment and medication relating to the condition is covered by the scheme and will not affect your savings. Each plan has a formulary guiding members on which medications are available on their plan. Co-payments may apply for non-formulary medication. It is necessary for all members to use designated service providers to avoid a 20% co-payment on their chronic medication. Let's discuss day-to-day benefits. Discovery offers a variety of options to meet members' different needs. Discovery's core plans do not offer cover for day-to-day benefits. Benefits are only available for in-hospital and chronic cover. Key Care and Smart members do not have access to savings, yet day-to-day benefits are available to members on this option via network arrangements. Day-to-day cover on all Discovery's saver plans are available to members via a medical savings account. The allocated savings available on each of the plans are as follows. Classic options, 20%. Essential options, 10%. Coastal options, 15%. Once savings are exhausted, members have additional benefits available from the extender benefit. The day-to-day extender benefit covers pharmacy clinic consultations in the Discovery network, as well as video call consultations with a network GP. Members also have cover for consultations with a network GP when referred. Consultations are unlimited for executive, comprehensive, and priority plans, while saver plans have limited cover depending on the option selected. On the executive, comprehensive, and priority plans, once members have closed the self-payment gap, they will have access to the above threshold benefit, where additional benefits will be available to them. The above threshold benefits on the comprehensive and priority plans are limited to a rand cap value depending on the family size. Comprehensive maternity and post-birth risk benefits are available to members on all Discovery options. Now that you have a better understanding of the key components of your medical scheme, let's take a closer look at the options that are available. The executive option reimburses hospital claims at 300% of the Discovery Health rate. The classic options reimburse hospital claims at 200%. Both the executive and comprehensive options offer members an additional disease list of 23 chronic conditions, where medications, once registered, will be paid from the risk benefit. This is not applicable to the Classic Smart Comprehensive Plan. The executive and comprehensive plans offer members rich day-to-day cover in the form of a savings account, followed by a self-payment gap and an above-threshold benefit. Whilst members are in their self-payment gap, they are able to make use of the extender benefit, which will provide them with unlimited pharmacy clinic consultations and network GP referred visits. Once the above threshold level is reached, members will have access to further cover for most benefits through a threshold. The Classic Smart Comprehensive option refunds hospital claims at 200% of the Discovery Health rate and covers 27 chronic conditions. Network hospitals are required for planned procedures. Unlike the other smart options, it offers members rich oncology benefits and an above-threshold benefit. Members have access to unlimited network GP consultations at a smart GP with a co-payment. All other benefits will be paid from the 15% MSA benefit. All day-to-day claims paid from the MSA will accumulate at 100% of the Discovery rate towards the annual threshold. Once the threshold is reached, members will have access to a limited above-threshold benefit which covers the same benefits offered by a comprehensive plan. The priority members have access to unlimited hospital cover. However, there are deductibles applied to 14 in-hospital procedures. This is an upfront payment for these procedures and can be claimed back from gap cover if applicable. Day-to-day is funded via a medical savings account, followed by a self-payment gap and a limited above-threshold benefit. Whilst members are in their self-payment gap, they are able to make use of the extender benefit, which will provide them with unlimited pharmacy clinic consultations and network GP referred visits. Once the above threshold level is reached, additional limited cover for most benefits is available. The Saver series offers 5 affordable benefit options. Members have access to a medical savings account to take care of their day-to-day needs. This value is determined on the plan selected. Should a member run out of savings, they would need to cover their day-to-day claims out of their pocket. However, additional limited cover is available from the day-to-day extender benefit in the form of pharmacy clinic consultations and referred GP network visits. The core plans are hospital plans only. Members on the core options do not have access to day-to-day benefits. Cover for outpatient MRI scans are not covered on these options. Maternity cover is available on all Discovery options. Note that when choosing a plan that makes use of hospital networks, co-payments may apply. The SMART plans restrict members to using certain network providers for hospital and day-to-day benefits. The classic SMART option refunds hospital claims at 200% of the Discovery Health rate. Day-to-day claims are limited to network providers. Members have access to unlimited network GP visits, limited medication prescribed by a smart GP and dispensed by a network pharmacy. The medicine limit is subject to R1,905 per person and R3,180 per family per year. Other benefits include eye test, dental checkup, a sports-related injury benefit, and an over-the-counter benefit. The Essential Smart refunds hospital claims at 100% of the Discovery Health rate. Day-to-day benefits include unlimited network GP visits, an eye test, dental checkup, and an OTC benefit. The Essential Dynamic Smart Plan refunds hospital claims at 100% of the Discovery Health rate. The dynamic hospital network will connect a member with the most efficient hospital for their admission at a specific point in time. Day-to-day benefits include unlimited network GP visits with a R125 co-payment, an eye test, a dental checkup, and an OTC benefit. The new Active Smart Plan is the new plan introduced by Discovery and offers hospital cover through the Dynamic Smart Hospital Network. However, all admissions other than neonatal or emergency have an upfront payment of R7,500, which is applicable. The day-to-day benefits mirror the Essential Dynamic Plan. Note that specific procedure exclusions apply to the SMART plans, as well as upfront co-payments if the SMART hospital network is not used. The KeyCare series offers affordable private cover through the Discovery Health Network. No savings is offered on these plans. Members have access to the following benefits on KeyCare Plus. Unlimited cover for hospital admissions, full cover in hospital for specialists, unlimited cover for medically appropriate GP consultations, blood tests, x-rays, or medicine through the KeyCare networks, casualty benefits for PMBs, essential cover for chronic medicine on the KeyCare medicine list, and extensive cover for pregnancy. Members on the KeyCare Start Plan have access to the following benefits: unlimited cover for hospital admissions at a network hospital linked to a KeyCare Start network GP, full cover in hospital for specialists, unlimited cover for medically appropriate GP consultations, blood tests, x-rays, or medicine through the KeyCare networks, Chronic medication can only be obtained via a state facility and extensive cover for pregnancy. Members on regional key care start need to make use of regional hospitals for full cover. Members on the Key Care Core Plan do not have access to day-to-day cover. However, limited specialist benefits are available through the network hospital. Discovery offers a comprehensive wellness program, Vitality. Vitality is a wellness and rewards program that empowers members to get healthier by giving them the knowledge, tools, and motivation to improve their health. As you interact with Vitality by getting active and making healthy choices, the Vitality points you accumulate determine your Vitality status. The higher your Vitality status, the greater the rewards you qualify for with various partners. Vitality will reward members for eating healthy, taking care of themselves, and exercising. By maximizing your Vitality rewards, you unlock access to discounted benefits for the whole family. Let's take a look at the 2025 contributions. As advised, the key care options are income-banded plans. This means your contribution will be based on your gross monthly salary. Although we make every effort to get things right, there may be times when you feel that you have not received the level of service you are entitled to. The complaints procedure can be downloaded from www.nmg.co.za. Please reach out to your NMG consultant if you need any assistance with your plan choice.